Hello, my name is Professor Helen Rees. I'm based in Johannesburg, South Africa at the University of the Witwatersrand, and I'm one of the leaders of the Crown Coronation trial. You'll hear in the course of this video questions and answers from many of my colleagues that will explain the Crown Coronation study and perhaps answer some of the critical questions you might be interested in hearing, such as how have we designed this, who will be involved, and when are we likely to get solutions. I hope you enjoy and learn from this video. Thank you.
Welcome everyone. We are here with several of the lead investigators for the CROWN Collaborative and CROWN Coronation trial. I'm going to start with some questions for Dr. Avidan about the CROWN Collaborative and the CROWN Coronation trial. Which countries are involved in this trial, and what are some of the innovative aspects of this group?
And we are a group of investigators from several countries in Africa, Europe, and North America. And the purpose of the Crown Coronation trial is to test promising interventions that might prevent COVID-19.
The next question I had was for Dr. Sikazwe. What are some of the challenges and opportunities with including low-income countries as part of this trial?
Thank you, Mary, for that question. I'm really excited to be part of this collaborative. As you know, Zambia, like the rest of the continent, hasn't been spared from this epidemic. And Zambia, like most of the other countries in our setting, faces other infectious diseases like HIV, malaria, and tuberculosis that are really a drain on the health systems. And our health systems are already struggling to manage those diseases. So COVID-19 adds to an additional layer of strain to it. The greatest opportunity, I think, is being able to contribute to science instead of waiting for solutions being brought to the continent or to Zambia, but being able to contribute to the generation of this evidence. As you know, our population is different. Not only are we facing the different infectious diseases, but we have a different population in terms of age. We have a much younger population. So how does COVID affect us? And when you add on the other bits of other infectious diseases, how will all those come into the mix? So
the next question I had was for Dr. Che. Why are you choosing to focus on COVID-19 prevention? And what are some of the practical considerations with regard to prevention measures?
Thank you very much, Mary. Let me also say that we are very excited in Ghana to be part of the CROWN Collaborative. As you know, healthcare workers are very few in Ghana and Africa in general. As, the doctor-to-patient ratio, nurse-to-patient ratio is very low. So we cannot really afford to have our healthcare workers infected and sitting at home. So that is why we think that focusing on healthcare workers at this point is very important. And as we all know, prevention is better than cure. There is no real cure for this disease. And none of the other measures that have been proven to work have focused on prevention. So we think this is a key area to engage in at this time. And I think we in Africa stand to benefit a lot from this. And that is why we are excited to participate in this study. Thank you, Mary.
Thank you very much. The next question I had was for Dr. Avidan. How do you choose which interventions to prioritize for the trial?
Because we're thinking about prevention, we're trying to think, how can we do things that boost the host immune response early so that either infection won't occur, or if it does occur, that it's a very mild infection. And we're also trying to think of therapies that are very safe, very tolerable, inexpensive, that can be scaled up all around the world.
The next question I had, building on what you just started, was actually for Dr. Delaney Moretloy. Why would someone participate in this trial and not one about the SARS coronavirus 2 vaccine? Why focus on the MMR vaccine specifically?
Thanks, Dr. Politi. That's a great question. And I think that all of the investigators in the CROWN Collaborative believe that it will be important to develop a specific SARS-CoV-2 vaccine, and that there are some really exciting candidates that are under development and a couple that have entered phase 3 trials. But at this point in time, we really don't know whether any of those specific vaccines are going to be effective. We can anticipate that they're not going to be 100% effective, and that in some instances, particularly in population groups like the elderly, they may in fact be weakly effective. And they also have an uncertain safety profile at this time point. But even if we do find effective specific SARS-CoV-2 vaccines, there will be delays with scaling up manufacturing, and there will need to be negotiations around access for countries around the world. And these may place significant limitations on gaining access globally at a time where we need rapid responses in the pandemic. So I think we at the CROWN Collaborative, and along with investigators in South Africa, think that it's really an important concept to evaluate the idea of trained innate immunity that can be generated through live attenuated vaccines like the MMR. And there's both compelling biological and observational data to suggest that this is a strategy that could work, that needs to be evaluated in a trial. But importantly, I think for people who might be considering participating in these trials, the MMR vaccines have been tested. They've been shown to be safe. They may provide participants with personal benefit against measles, mumps, and rubella. They're inexpensive, simple to administer, and could be available in low and middle income countries and scaled up rapidly during the pandemic while we wait for the development of specific SARS-CoV-2 vaccines. And I think finally, people are interested in this approach because it is a non-specific approach. It may be beneficial for future pandemics, and also may be possible to combine these vaccines in future so that the effects of non-specific vaccines could be used to amplify the antibody responses to specific SARS-CoV-2 vaccines. Thanks very much, Dr. Politi.
Very interesting. That's really useful. And I'm sure most of us don't want to think about a future pandemic, but it's reality, and it's important to think about both affecting and treating this current pandemic and what we might want to do in the future. The last question I have is for Dr. Debbie. I wondered if you could tell us a bit about the innovative design features of the trial that allow us to test more than one therapy.
So firstly, platform trial. As my colleagues have said before, we intend to start the study with the MR or MMR vaccine. But it's important to understand that we will also progressively introduce other treatments on the platform. There will be multiple prophylactic treatments that we will be using over the course of the study. Some treatments may graduate. Some treatments may demonstrate that they are superior to a placebo, and they will then become the backbone for the rest of the trial. That's a very important feature of the study. Now, with respect to the multiple treatment aspect of your question, as I said, some treatments will be given in combination. We are interested in the effect of all of the treatments separately, but we are also very interested in potential interactions between the treatments.
Dr. Avidan, did you have any final words you wanted to add about the trial and the platform?
I wanted to give big thanks to the COVID-19 Therapeutics Accelerator, which is generously funding the CROWN Coronation trial. The solutions to COVID-19 will come from science. And we hope that that will be as quickly as possible so that we can really defeat this pandemic and move on. So Dr. Politi, thank you for your great questions, and thanks to all of my colleagues with whom I have such delight interacting and working, and I look forward to the work we're all going to be doing together. Thank you very much.